Hi, my name is Casey Hirsch. I'm a licensed clinical social worker, author, and founder of LightYourSparkle.life. I'm very excited today to be here with Dr. Schwarz. He's a licensed psychologist and the executive director of the Association for Comprehensive Energy Psychology. He has decades of experience as conference director and training thousands of therapists in energy psychology approaches. As many of you know, I've used many types of energy approaches to address my own history of childhood trauma and my chronic condition of Crohn's disease, which is an autoimmune illness. I didn't realize that there was an association for energy psychology till many years into my own clinical training program and my role as a licensed therapist. So today I'm excited to talk to Dr. Schwarz about the ACEP and to find out how his agency can help us with resources and support and additional training. Hello, Dr. Schwarz.
Hi, Casey. How are you?
Good, thanks. Thanks for being here.
My pleasure.
So can you just start out by describing the mission of the ACEP for all of us?
Well, the mission of the organization, the Association for Comprehensive Energy Psychology is an association of mental health and allied health practitioners that use energy psychology techniques, to put it succinctly. And the mission really is to train therapists and other folks in these techniques and to get energy psychology techniques and related techniques out into the mainstream. So, as I said, lots of folks still don't know about it. So we're trying to get the word out and to do it in a way that's, high quality and with ethical and all of those things as well.
So for people who don't know what energy psychology is, can you give us a brief overview?
Sure. So energy psychology is a term that actually applies to a set of different techniques. And these techniques, what they do is, for the most part, there's some variation, but they are a combination of more standard, psychological approaches, such as focusing on, exposure to traumatic memories, reframing, dealing with people's thoughts and feelings. But we do it in a way that we're also going to be having clients activate the energy, some of the different energy centers of the body. So the ones that are most commonly used are the acupoints. So when people may know of tapping on acupuncture points, that's the most common. Other people use chakras. And there's some other approaches that use a combination of things. And then there's also working with the biofield itself, which surrounds the body. But what makes energy psychology is the integration of the psychological approaches along with activating these aspects of the body, which help process things more quickly.
So what types of conditions, you mentioned something about, trauma and emotions and feelings, but what types of conditions can people use these approaches for?
Well, a lot of them, actually. There really probably isn't much that you couldn't, certainly anything psychological, and you can certainly use them for the most part. And there are, as you mentioned, there are a lot of any approach, any kind of problem that has a mind-body connection. This will help with that aspect. From a research basis, because there actually is a fair amount of research, energy psychology has been shown to be very effective in working with PTSD, post-traumatic stress disorder, any kinds of trauma, anxiety, depression, weight loss, pain, to name a few, phobias. But if it's, that's the research, but most, you can use it for anything that you can use psychology for. You can use energy psychology as one of the tools that you would use. And again, as you mentioned, I think it's working with anything that's stress related, because it helps people reduce their stress and current stress, number one, and then anything that's sort of stored stress. So I know you've alluded to when people have, for instance, autoimmune disorders or sometimes pain disorders, other disorders, there's often stored stress in the body that appears to be at least contributory to development of symptoms or symptoms getting worse.
And it sounds like the energy psychology approaches can be used in conjunction with other types of treatment and can also help speed up recovery and healing by accessing parts of the illness or the emotional state that maybe you can't access as quickly in talk therapy. And
That's
also
right.
by offering a support just in general for the integrative healing model that it sounds like the ACP is striving for in terms of how to integrate these techniques with the broader medical and mental health community.
Yes to the for sure the latter. We're definitely looking to integrate with other approaches, and it does seem to work quicker. I mean, you can, depending on what you're talking about, there's more or less research that would show that, but it does seem to have it does seem to work quicker than just talking. Talking's good.
Yeah.
But,
So, Dr. Schwartz, can you talk a little bit about the types of training that the ACEP offers?
well, we offer, there's a few. So we have some we have some online training, survey courses. We have a big training on the science of energy healing. We have a couple of courses on that. But if you're talking about energy psychology, we have two main trainings that we do. Actually, three, actually. We have an online training in thought field therapy that actually somebody else does, but that we help put that out. We help put it out through on our website. We have a full EFT training that we have created from knowing nothing to becoming certified. And I'll talk more about that in a minute. And then we have a training called Comprehensive Energy Psychology, which goes everywhere from knowing very little all the way to getting certified. The main difference between EFT and the CEP, Comprehensive Energy Psychology program, is EFT is only focused on one technique called Emotional Freedom Techniques, or EFT. So it's more of a going deep on into one program, where this Comprehensive Energy Psychology is a broader approach that allows clinicians to, and it provides a framework for clinicians to integrate a lot of different energy approaches, and so they can know what to do when and where, and then there's some specific training along with it.
So, are the trainings available for licensed and non-licensed practitioners?
So our EFT program is only available for licensed practitioners. There are other programs that do work with non-licensed. There's a long story. Our program a few years ago went online. We created a virtual program, and we're really cutting edge on that because we found ways to take the training that you get on live, and then now, of course, the world has caught up with Zoom. We were a little ahead of the curve. So, but because we did it that way, we wanted to make sure that we wanted to only work with one level of a person. It's perfectly fine to train people who are not therapists, but to train them both at the same time, we find it's more challenging, and we thought it was more ethical and more prudent to do it the way we did it. The CEP program is a live program, although currently we're not meeting because of the COVID thing. And that trains both licensed professionals and non-licensed professionals, but there are some caveats for non-licensed folks.
Would you mind expanding a little bit on that? Because I feel like with trauma, sometimes there's risk, especially when working with people who have not had their own therapy before, or maybe they're not aware of their history of trauma. Can you talk about the caveat for how you might do that
Sure.
with non-licensed?
Well, gosh, that's all right. So, well, first of all, there's something, I mean, you probably know, something called scope of practice. So if you're going to work with, if you're a non-licensed person and you're going to be working with traumatic events, you need to be really well trained. Just because somebody has a license per se doesn't make them a great trauma therapist, and just because someone doesn't have a license doesn't make them not a good trauma therapist. Having said that, though, there are certain rules and regs, and you kind of want to make sure you want to do your best. So there's an entire curriculum that people need to know about how to do trauma treatment, and most of those things are learned in various therapeutic schools. Again, if you're not a licensed professional, you need a lot of additional training. But even then, depending on where you are, you may actually be doing something called doing psychotherapy without a license, and you would be running afoul of the regulations in your state, even though you might be doing really good work. On the other hand, you might not be doing really good work. And if you're a licensed therapist, you could be a licensed psychologist or whatever, but be just a terrible trauma therapist. And by the way, there's a lot of terrible treatment out there that's done by licensed people, at least in my opinion. So just because you're licensed doesn't guarantee it's any good either. So it's kind of a caveat emptor for the public, you know.
Certainly,
Sure.
and I appreciate what you're saying, that it doesn't mean that if you don't have a license that you're not a great practitioner. But at the same time, there are ethics and there's a scope of practice, and in order to not do any harm
Right.
to a client, you need to stay within that scope of practice.
Right.
And it was comforting for me because I learned about the ACEP and that there were several tracks of training, and it was comforting for me to know that there was some differentiation between the training for non-licensed and licensed, because as a therapist, I would want to feel like I could go a little deeper into the trauma based on my skill and my training. And then for someone as a patient, when I've seen folks who have done great work with me, sometimes I feel like if they're not licensed, they probe a little bit too much into the trauma. And there's not always a protection for me as the patient with, referrals, making sure that I have a referral to a licensed therapist if necessary, making sure that they know how to calm down the nervous system if I get a little too elevated, because maybe something might come up.
Right.
That, as a surprise, you never know what's going to come up. So
Right.
is that true that some of those pieces are incorporated in the training depending
Yeah.
on what someone brings to the table?
Right. No, that is incorporated. I mean, it should be incorporated. And again, so for instance, if someone's not licensed, there's always conversations around scope of practice, making sure that you have appropriate referral sources, because there's official trauma, like someone's got things that are called big T trauma, where it's like everybody agrees this is a really bad thing, right? And versus little T trauma, which are any number of things that can be traumatic to a person, but don't quite meet the formal definition of, like, a bomb fell on your head. I mean, you can get yelled at and shamed in school by a teacher. Is that trauma? It's a little T trauma. It can be a little T trauma, but it generally doesn't meet the criteria of a big T trauma. So people who are doing coaches need to know where those lines are, and need to know, and they don't always know when they're going to step from one into the other, because sometimes the clients don't know. They don't have it well organized and saying, well, these are my little T traumas, and these are my big T traumas, so you can work with these, and they don't know that. So it's up to the treating person to understand those differences and to know when to refer.
Yeah, and to know that it's so much of trauma is perception. So someone might have a loss of a pet or
Right.
a number of different things, and however that person perceives it and how that manifests in their body and their response can turn into a big trauma, but it may not seem like that on the surface. So just knowing
Right.
where those lines are and how to properly, look at the person is important.
Right. So there's some, I tend to have this little thing I talk about, trauma is not based on what happens on the outside. It occurs when the resources, the negative effect of the outside thing is greater than your resources. So we talk about this I talk about this when I train. It's like, the great example of trauma treatment sort of is Alien and Aliens. Remember in the movie Alien, Sigourney Weaver goes and she goes to this horrible event, and we all leave the theater totally traumatized. Right? And then the second movie, Aliens, is really this kind of surreptitious treatment. So we all come in traumatized. She's traumatized, and and then you go through, and she's gathering resources the whole time through. And so good trauma treatment is also about gathering resources, whether it's using energy psychology or not, so that you can process and deal with what happens in a way that you're not overwhelmed. But the whole hero idea, heroes always have really bad things happen to them, heroes and heroines, but they always stay resourceful. That at least so they become resourceful. And so that's the sort of the archetype of it that we fantasize about. And good trauma treatment helps people become more resourceful.
So if a person's a patient, or there's someone like me who's got these chronic conditions, and they say, "Oh yeah, I want to try some of these techniques and see how they might help what's going on," where would they go to explore further getting treatment with energy psychology techniques?
Well, I'm biased. You certainly could come to our website and get we have it's which is energypsych.org, and at the very top of the website, there's a thing that says find a practitioner, and then you can look up people who are practitioners. You can look for, there are other organizations that have practitioners. There's EFTI, Emotional Freedom Techniques International, and so on. So there you can look people up. You want, ideal in a perfect world, you want to find somebody that's certified and has an appropriate credentials, and you can ask them about that. The world isn't always a perfect world, but those are good starting places. And then, like any good, like in therapy in general, you want to meet the person. Regardless of what their certifications are, it should feel safe talking to them. You should feel good about it. You should have a sense that everything's contained, and there's that whole process as well. But the two places to start off would be, for instance, ours would be our find a practitioner
Great,
list.
excellent.
We have a few
And
different.
I think what you're saying is that just because you're a patient, it's still important that you interview the person that you're going to see, and that there needs to be a good fit. And we're empowered to do our homework and to interview the clinician or the therapist ourselves. It's not one direction. We should both be looking at what's a best fit for the relationship and how it's going to further treatment.
Yeah, absolutely. It's also really hard. I mean, you need to, if you're a patient, if you're a client, you want to, again, the more you can know, the better informed a consumer you are, the better informed, the better you'll get. So you want to learn it. You can go to our website. You can learn about energy psychology. You can go on the internet. You can look at things, take with a major grain of salt, by the way, because there's a lot of stuff on the internet that's some's good, some's not so good. And then you really need to, learn about trusting yourself and discover if something's worthwhile, if it fits. Because if it doesn't feel good, don't do it. Don't think, oh, there's something wrong with me. Oh, maybe. No, if it's not feeling right, the person could be a great therapist, just not good for you for whatever reason.
Yeah, and I sometimes think when we're in a vulnerable position of, we're not feeling well, and you feel like, okay, I've got to go through this. I've got to push myself through maybe this traumatic event or the feelings associated with it. And if it doesn't feel right, you have to trust yourself, because it's not supposed to be something that you have to plow through or feel like you have to push yourself through to get to the other side. That's not how healing really works.
Well, I'm glad you mentioned that. And there are therapies out there that's exactly what they say you should do. And I respectfully disagree. If you're talking about trauma, it should not be abreacted. You should not have to suffer through it. And the reason that one of the things that drew me to energy psychology is it's an approach that makes it that you can deal with actually relatively painful things without a lot of, tons and tons of pain. You can process things in a way that feel a lot safer, that are contained. And in trauma treatment, if you know nothing else, this is a great thing. There's this idea of the window of tolerance. So it's like the Goldilocks, not too hot, not too cold. So treatment needs to, if it's too cold, nothing's going on. But if it's too hot, it's going to blow out your nervous system. You won't, and that's not good either. So if it's too hot, no good. So it's got to be in the middle. A little bit of upset's one thing, but if you can't handle it, it's not your fault. Then the therapist has failed to keep you contained. And that's a function of the treatment. And some treatments are just blow people out the top all the time. It's not okay.
Yeah, I would agree with that. Some treatments are they're a little bit too diagnostic, and people might try to give a narrative to the patient about what they think is the trauma and why they think something happened. And the patient has to also be involved in that because they also know their story. You don't want to stay in the story for too long because that can be re-traumatizing.
Well, that's an interesting point. So a lot of people want to tell their story, and you can tell your story at least once. That's fine. But one of the things in what we teach in EFT, emotional freedom technique, is how to tell a story. When we treat people, we don't let them tell the story to the point where they're where they lose it, because that's re-traumatizing. So there's very specific techniques so that you can tell it, but you tell it and then you bring it down. You tell it part way, you bring it down, so that your nervous system stays calm or calmer, and then eventually you can go through the whole thing totally calm, which is how do you know if a trauma is healed? Well, one way you know is that you can tell the story and your body stays calm, because it knows without, you don't have to talk about it. It feels safe. That's one of the great measures.
Well, Dr. Schwartz, I appreciate you taking the time to talk with me,
My
and
pleasure.
I'm really hoping that this dream I have of integrating these approaches with the medical community and the mental health community. I'm passionate about hoping that eventually everybody can work together and we can do what we're good at, but there can be referrals back and forth and lots of support for incorporating these techniques into the work that everybody's doing out there.
Well, I like your dream to me too. That's what it's all about. So that's great.
So, okay. And once again, give us the website that people can go to if they want to explore more.
It's energy psych, ENERGYPSYCH.org.
Okay. Thank you so much.
My pleasure.